Hi, I'm Moufida Holubeshen. We're back again to talk about reflections, some trends, and first off, happy 2024. It's been 5 months since I've had my last laser treatment for my tumor, and everything's all clear. So it's all good. We will have one more session with this series on basal cell carcinoma in April just to close things off. But in this episode, what I'd like to talk to you about is our reflections, thoughts on broader issues, as well as some trends around basal cell carcinoma specifically. So to start off, was this the best approach for us? Yes, that was the best approach for John and myself, considering our skill set and our circumstances. He has very specific technical skills, I have very specific research skills, and combined we tend to be less risk averse. This is not the answer for everybody. We do not recommend this approach for everyone. But we have shared our story to share this information, so when you have your journey, you can use it to inform your decisions, which will be different because this is a different time and different information. So to start off with, I do not recommend that you do this yourself. This is not the best machine. And are we keeping it? Yes, of course we're keeping it. Even though it's not perfect, it does work for us. And with 40% chance of getting basal cell carcinoma, now that I've had one, then yes, I think that it's very handy to have. And in fact, I had some spots here that were persistent, more than 6 weeks, shiny, and less than a millimeter, around a millimeter, and I treated them because I felt they were exactly the same as the one I was getting here, but at a much earlier stage. So 3,000 pulses worked for me, they're gone. And I intend to be proactive in treating anything that looks like basal cell carcinoma. So just to be clear, this is strictly for basal cell carcinoma. Do not use this on melanoma because it masks the roots. Melanoma roots are much longer. Other things that we thought about in terms of reflections, it occurred to both of us that the aesthetic industry that does use tattoo removal equipment and has the training and the certification could be useful in administering this kind of treatment, assuming that there is a standard that's established in British Columbia medical standard where they could treat pre-diagnosed tumors. Now that made us think about the medical system and at what point something becomes a medical condition versus an aesthetic condition. Because I can imagine that people getting aesthetic treatments for removing sunspots, maybe proactively removing potentially cancerous tumors ahead of time. So I don't really know when something becomes cancerous versus precancerous. When does it go into aesthetics versus a medical condition? Those are questions that left us scratching our heads. Another issue that came up for me is the medical system care for people who either go out of country for care or self-treat. What's the kind of follow-up that one can expect? Are you going to be abandoned? I was very lucky in terms of the kind of cancer I got was very slow growing, but I know I hear through the news some not great stories of people with internal cancers and going out of country, but perhaps not getting the follow-up they need when they come back. So again, another question I have, we're all taxpayers, we all pay our taxes, and why would they not be entitled to care afterwards? And that takes me to why I retired. Some of you asked that questions when I retired, and I tried to answer vaguely, but the reason I retired was I could no longer rest my glasses on my nose piece. So if I can't see and everything I do at work is through the computer, then I can't read. And if I can't read, I can't work. That combined with the time it took for treatment, researching the treatment, administering the treatment, recovering from the treatment, let me just say, it was not something that I felt comfortable sharing with my employer. And I know, having been a supervisor managing somebody's out-of-country treatment, employer systems are just not set up for that. So I thought retiring would help me better able to focus on my well-being and really take care of myself. And I think that's all I have with respect to our reflections. So that takes me to some of the research I've done in terms of trends around basal cell carcinoma. So trends in basal cell carcinoma, not all the other skin cancers, just specific to basal cell carcinoma, are such that since 2017, it's the second highest cancer being diagnosed worldwide, and 77% increase since 2017. So for Canada, we have 80,000 cases of basal cell carcinoma per year diagnosed, and in the US it's 1 million. Again, it's very specific to basal cell carcinoma. So I'm challenged when I look at those figures, and then I look at the fact that 66% of basal cell carcinoma occur around the neck and the face, which is, the face is where Mohs surgeries are recommended because it's higher risk automatically when it's on your face, never mind near your eye. And we have somewhere between 21 and 30 Mohs surgeons in Canada. So in my mind, there's not enough supply of Mohs surgeon to meet the demand. So that's where my mind goes to, can we use other mechanisms to pre-treat basal cell carcinoma before it gets to the point that it needs Mohs surgery? Laser is one of them, perhaps there are others. So I looked into that some more, and in my research, I discovered lots of innovations that are happening all over the world around the treatment of all kinds of cancers. And I'm going to share with you very quickly what I put in the link below, lots of articles on different types of innovations. And to start off, around diagnosis, Australia is on the forefront. They're creating an at-home test called DermR that basically takes a piece of tissue and you can check to see if you have skin cancer. And if you do, then you get a biopsy. So that's pretty cool. There's a 14-year-old in the US who's partnering with 3M to create a soap that treats basal cell carcinoma. I've also put a link on essential oils. What's a myth and what's truth. Make sure if you're into essential oil, you read all about it, because it's the extract that's the active component in certain essential oils that actually can treat types of cancer in vitro. So it hasn't been proven, but interesting to monitor and read about it. Other innovations that are happening are in the diagnosis, which I talked about, but also Google Lens, we talked about that. There's the optical coherence tomography, I talked about that as well. There's a guy who's doing ultrasounds to diagnose the size before operating. And there are all kinds of apps besides Google Lens that can pre-diagnose things for you before you go to the doctor. In terms of treatments, besides the Nd:YAG laser, there's also brachytherapy. That's basically radiation, like X-ray radiation, and it's non-invasive. That's being done in the US already, so it's not as new as some of the other things I mentioned. As well as there's a gentleman in Massachusetts that they're doing pulse dye laser. So lots of great things happening. In addition to that, BC has just revamped their referral system. There's a news article in June on how they've simplified it, which is great news. And in Australia, they use nurse practitioners to actually do dermoscopic diagnoses. So that's, again, reducing the time between the time you actually see somebody and get to treatment, all of which is great. So our story is in our timeline. Your story, your journey, or your loved one's journey is going to be different, and definitely a better journey because you're informed and you have all these things, great things that are happening. So if you would like to follow this story and hear about what's happening in April, we will do one more episode. Please subscribe for that. And make sure you review the links below because they're super interesting articles. In April is when my surgery is scheduled, where I hope I can let you know that I've canceled my surgery and that everything is A-okay. And perhaps there are questions that people have, perhaps there are other developments. I will include them in that episode in April. So please subscribe, like, or comment, and bye for now.